Case study for hypothyroidism by Lena Hall. The case study I will be going over is in regards to a graduate student who has noticed that despite numerous unhealthy snacks weekly as a method to cope with their studies, they are losing weight. They attributed the faster pulse and jitters to the cups of coffee, several Red Bull drinks, and no-dose pills used to pull all-nighter study sessions. At first, they thought any nervousness was anxiety about school, but they present today believing the stress of school is so high they have trouble sleeping, cannot sit still, and is having problems concentrating. They have a sore throat that is different from a typical one because it appears to hurt only on the anterior aspect of the neck and not deep in the posterior mouth. Hyperthyroidism, also called overactive thyroid, is when the thyroid gland makes more thyroid hormones than your body needs. The thyroid is a small butterfly-shaped gland in the front of your neck. Thyroid hormones control the way the body uses energy, so they affect nearly every organ in your body, even the way your heart beats. With too much thyroid hormone, many of your body's functions speed up. So what can cause hyperthyroidism? Graves' disease is the most common cause of hyperthyroidism. Graves' disease is an autoimmune disorder, and with this disease, your immune system attacks the thyroid and causes it to make too much thyroid hormone. A patient may also have an overactive thyroid nodule. Overactive thyroid nodules, or lumps in your thyroid, are common and usually not cancerous. However, one or more nodules may become overreactive and produce too much thyroid hormone. Overreactive nodules are often found in older adults. Another cause could be thyroiditis. Thyroiditis is an inflammation of your thyroid gland, and some types of thyroiditis can cause thyroid hormones to leak out of your thyroid gland into your bloodstream. As a result, it may develop symptoms of hyperthyroidism. Thyroiditis can also cause symptoms of hypothyroidism or underreactive thyroid. In some cases, after your thyroid is overreacted for a period of time, it may become underreactive. Another cause could be too much iodine. Your thyroid uses iodine to make thyroid hormone. How much iodine you consume affects how much thyroid hormone your thyroid makes. In some people, consuming large amounts of iodine may cause the thyroid to make too much thyroid hormone. Some cough syrups and medicines, including some heart medications, may contain a lot of iodine. Seaweed and seaweed-based supplements also contain a lot of iodine. Sometimes too much thyroid hormone medication. Some people who take thyroid hormone medication for hypothyroidism may take too much. If you take thyroid hormone medication, see your doctor at least once a year to have your thyroid hormone levels checked. You may need to adjust your dose if your doctor finds your thyroid hormone levels too high. Some other medications may also interact with thyroid hormone medication and raise hormone levels. If you see your thyroid hormone medication, ask your doctor about interactions when starting new medications. And lastly, non-cancerous tumors. In some rare cases, a non-cancerous tumor of the pituitary gland located at the base of the brain can cause hyperthyroidism. Physical and clinical manifestations. Our patient within the case study was showing common physical and clinical manifestation. The patient states she's experiencing jitters, which also could be associated with tremors, which would be considered shaky hands and or muscle weakness, palpitations, rapid or irregular heartbeats, and she's experiencing anxiety, which could include nervousness, irritability, issues of concentrating, trouble sleeping, or fatigue. She also complained of weight loss despite an increased appetite. A patient with hypothyroidism may also show physical symptoms of heat intolerance, which would include sweating and or trouble tolerating heat, an enlargement in the neck, also known as a goiter, irregular menstruation or short and light menstruation, and the patient could also have abnormal protrusion of eyes or puffy eyes. Differential diagnosis. Hyperthyroidism presents with relatively nonspecific signs and symptoms such as palpitations, increased frequency of bowel movements, and weight loss, among others. Therefore, other pathologies should be ruled out as possible explanations for the patient's symptomology. For the etiologies of hyperthyroidism, differential diagnoses can be made based on the physical findings of the thyroid gland. Palpitations of a normal thyroid gland in the context of hyperthyroidism can be due to Graves' disease, painless thyroiditis, or factitious hyperthyroidism. Graves' disease can also present as a non-tender enlarged thyroid. Palpitation of a tender enlarged thyroid may indicate subcutaneous thyroiditis. Palpitations of a single thyroid nodule is likely indicative of a thyroid benign tumor, and palpitation of multiple thyroid nodules strongly indicates toxic multinodule goiter. Other differential diagnoses include euthyroid hyperthyroxanemia, which serum totals of T4 and T3 are elevated, but the TSH level is within normal limits. There's also is struma ovaria, which is a rare ovarian tumor defined by the presence of thyroid tissue compromising more than 50% of the overall mass. Potential complications. Untreated hyperthyroidism can cause serious health problems, including an irregular heartbeat that can lead to blood clots, stroke, heart failure, and other heart-related problems. An eye disease called Graves' ophthalmopathy, thinning bones or osteoporosis, menstrual cycle and fertility issues. Untreated or unmanaged hyperthyroidism can lead to an extreme case of hyperthyroidism referred to as thyroid storm. Thyroid storm is a rare, life-threatening condition characterized by severe clinical manifestations of thyrotoxicosis. Patients with thyroid storm typically have an exaggeration of the usual symptoms of hyperthyroidism. The classical symptoms of thyroid storm include tachycardia, hyperpyrexia, central nervous system dysfunction, which would include agitation, delirium, psychosis, stupor or coma, and gastrointestinal symptoms, nausea and vomiting, and abdominal pain. Physical examination may reveal a goiter, ophthalmopathy, in the presence of Graves' disease, lid lag, hand tremor, and warm and moist skin. Thyroid function tests show hyperthyroidism, which would show a suppressed thyroid stimulating hormone, TSH, elevated T4, and elevated T3, generally comparable with that in patients with uncomplicated overt hyperthyroidism. Labs and diagnostic workup. Thyroid blood tests will include a T4 test, which tests for hypothyroidism and hyperthyroidism and used to monitor treatment for thyroid disorders. Low T4 is seen with hypothyroidism, where high T4 levels may indicate hyperthyroidism. A normal range for an adult is 5.0 to 11.0 micrograms per deciliter of bloods. FT4 or free T4 is a method of measuring T4 that eliminates the effect of proteins that is naturally bind T4 and may prevent accurate measurements. Normal test range for an adult is 0.9 to 1.7 nanograms per deciliter of blood. T3 tests help diagnose hyperthyroidism or to show the severity of the hyperthyroidism. Low T3 levels can be observed in hypothyroidism, but more often this test is useful in the diagnosis and management of hyperthyroidism, where T3 levels are elevated. A normal range is 100 to 200 nanograms per deciliter of blood. FT3 or free T3 is a method of measuring T3 that eliminates the effect of proteins that naturally bind T3 and may prevent accurate measurement. Normal range is 2.3 to 4.1 picograms per milliliter of blood. The thyroid stimulating hormone is the TSH. It is produced in the pituitary gland that regulates the balance of thyroid hormones, including T4 and T3 in the bloodstream. This is usually the first test your provider will do to check for thyroid hormone imbalance. Most of the time, thyroid hormone deficiency, hypothyroidism, is associated with an elevated TSH level, while thyroid hormone excess hyperthyroidism is associated with a low TSH level. If TSH is abnormal, measurement of thyroid hormones directly including T4 and T3 may be done to further evaluate the problem. Normal test range for an adult is 0.40 to 4.5 milli-international units per liter of blood. For the treatment of hyperthyroidism, some patients will consider for a treatment plan radioactive iodine. You take a pill or liquid by mouth and it gets into your bloodstream and destroys the overactive thyroid cells. This causes the level of thyroid hormone in your body to decrease. Symptoms often lessen in 3 to 6 months. The result is a permanent low thyroid activity or hypothyroidism. This condition can be treated with thyroid supplements. Despite concerns about radioactive material, the treatment has been used for more than 60 years without any problems. Most adults in the United States who have had hyperthyroidism are treated with radioactive iodine. This option is not suitable for women who are pregnant or breastfeeding. Another option is anti-thyroid medication. These drugs tell your thyroid to produce fewer hormones. Symptoms begin to improve in 6 to 12 weeks as your hormone levels adjust. Treatment can last for at least a year. This is a better option for women who are pregnant or breastfeeding. Surgery is another option, and you can have a thyroidectomy, is when the doctor removes most of your thyroid gland. After surgery, you likely will develop hypothyroidism, and you can take thyroid supplements to restore your hormone levels back to normal. Beta blockers are also utilized in treatments. These drugs can slow your heart rate and reduce tremors and anxiety. They can be used with other forms of treatment, and you should be able to stop taking them once your thyroid levels return to normal. When educating our patients, patients should understand that this is not preventable. You cannot prevent hyperthyroidism. However, it is treatable and there are steps the patient can take to help reduce their symptoms. It is important the patient takes their anti-thyroid medication at the same time each day. And it is also important to educate on lifestyle changes. If a patient is diagnosed with hyperthyroidism, lifestyle changes may help reduce their symptoms. Avoiding caffeine and reducing stress may help relieve symptoms of anxiety, nervousness, poor concentration, and fast heartbeat. It is important that the patient follows up with his or her physician. Risk factors for hyperthyroidism is women are more likely to develop hyperthyroidism than men. A family of thyroid problems, particularly Graves' disease, increases a patient's risk. If a patient has an autoimmune disease such as type 1 diabetes or Addison's disease, they are at risk. Smoking cigarettes is associated with increased likelihood of developing Graves' disease. And stress may also increase the risk of developing hyperthyroidism. You also should follow up your physician if you are experiencing any symptoms that you believe may be related to your thyroid. Re-evaluation and ongoing monitoring. When starting anti-thyroid medication, it is recommended to obtain a baseline set of labs to check complete blood count and liver enzymes due to the potential side effects, which are overall rare. Common minor side effects include fever, rash, pruritus, hair loss, swelling of the lymph nodes, headache, muscle pain, and pain in the joints. More severe side effects include a granulocytosis, hepatotoxicity, vasculitis, lupus-like syndrome, and neuritis. It is recommended to check a free T4 and T3 at 2 to 6 weeks after initial therapy and adjust dosing accordingly to the levels. It is not recommended to check TSH because it may remain suppressed for months. Once normal thyroid function is achieved, the dose can be decreased by 30 to 50% with continued monitoring every 4 to 6 weeks. There's no recommendations for routine monitorings for these labs once established on anti-thyroid medication and you have a normal level for your thyroid levels. So it is actually a provider's preference.